morning, everyone. I'd like to call the October 24th Finance Committee meeting to order. I do believe, do we have Jim Zay? Is he coming in? Okay, where's that language? A physical quorum of the members is physically present. I'll entertain a motion for those members not physically present due to illness, disability, or employment purposes, or for the business of the board or family emergency to participate by video or teleconference. I have a motion by member to start, second by member Childress. All in favor? Opposed? Okay. Can we have a roll call?
Thank you.
Member Cahill. Member Chaplin.
Here.
Member Childress.
Yes.
Member Colbert. Member Desart. Member Eckhoff. Member Evans. Member Galassi. Member Garcia.
Here.
Member Guston. Member Krajewski. Member LaPlante. Member Ozog. Member Rutledge. Member Schwarzy. Member Tornatori. Member Yu.
Here.
And Member Zay.
Here.
Okay, thank you. We have a quorum. Do we have any public comment this morning? Okay, we have no public comment. Chairwoman's remarks, really quick. We have a full agenda today. I'm looking forward to our two presentations from the Health Department and Information Technology. Also on today's agenda, you're going to find several budget resolutions and ordinances. So please feel free to ask any questions. I know we have a lot of new members, so feel free to ask questions. After the budget is passed today, the budget and financial plan will be made available on the county's website, and we will ensure that it's accessible to the public for a minimum of 15 days prior to the scheduled passage of the budget on November 28th. Okay, so with that, I would like to welcome Adam Borker. Come on up, Adam, from the DuPage County Health Department. Welcome.
Thank you every time. Okay, and thank you for your time this morning. I'm very excited to bring my team's budget forward to you and discuss some of the opportunities and challenges with that at a really pivotal time for local public health. I think there's a slide deck that's going to queue up. There we go. So for the first time in over 3 years, COVID is no longer a central theme and focus for our budget development, which of course is very exciting. We're now better positioned to focus on our community's recovery from the pandemic and the myriad of public health issues affecting our residents today and into the future. Public health is really about serving our community and ensuring the conditions in which everyone can be healthy. So this morning, we're going to get to some budget numbers and some challenges and opportunities I have associated with that. But first, I want to take a few minutes taking a macro view of what supporting our local health department and our budget, what that means. Investments in local public health means investments in clean water to drink, safe food to eat, and a focus on healthy families. Investments in local public health means investments in preventing the spread of disease. We're often managing disease outbreaks that are unseen. We're working with long-term care, correctional facilities, other high-risk settings to battle measles, Hep A, other superbugs. That work goes on behind the scenes day in, day out. It also means delivering vaccinations, educating the public on healthy lifestyles. We know public health is really about the business case that is prevention, because we know an ounce of prevention is worth a pound of cure. Now, if you had only one takeaway from me this morning, I would wish for it to be this. It is that our health department, your health department, our strategy for delivering public health to our residents happens on two levels. First, we serve as the chief health strategist for our community. We're assessing the needs, we're convening local leaders, and we're seeking to impact health at the population level. So we're working with all our partners to address systems and policy for collective impact. So first, we're really looking at the entire community as our patient. But then there are also times when the care needs of our residents remain unmet, and we must act to serve as a safety net provider for those residents and provide direct clinical care in those instances. So that is our behavioral health services, which we'll talk a lot about this morning. It's our maternal and child health services. It's our dental clinic, our STD clinic, and more. So we're really always working on these two levels. This is this 1-2 punch of public health in DuPage, at the community level, at the population health level, and then as a safety net provider. So just a brief glimpse at a few of the top public health areas that we're focused on. I mentioned our work managing disease outbreaks. Thankfully, we believe the worst of COVID is well behind us. But we also believe that we can't let our guard down, that there are always new emerging novel pathogens like we saw with monkeypox or mpox last summer. So investments in communicable disease work is critical. They analyze the data, they identify the risks to the community, and then they help develop public messaging for our residents so that they can protect themselves. Of course, we know we're seeing very unique and evolving challenges with behavioral health right now. And we're going to talk about the investments that we need and hope to make in behavioral health. We're, of course, I believe we're making progress culturally with stigma and reducing stigma. I believe that we're seeing more of a openness to discussing the challenges associated with mental health, but we're also seeing a rapid increase in demand for services. And I do want to call out our environmental health services. This is another area where the work is often unseen. We are of course interested and paying attention to the impact on health of climate issues, but we're also doing work day in, day out that is kind of invisible. We operate a massive food safety program in this county. Our team permits and inspects over 4,200 food facilities across the county every year. Now, we know during the pandemic that restaurants were significantly disrupted, curbside carry out only, we're all familiar. But as the restaurant businesses come really bounding back pretty well in DuPage County, that has meant a flurry of activity for our team. A lot of new owners and operators and a lot of work and a lot of time investment for our staff to make sure that they're educating, inspecting, and training at a level that makes sure our food is safe. So that's the community level. Now at the individual level, something I think is really important when we talk about being a safety net provider and a healthcare provider, we want to take stock of what that means. Medicaid enrollment has grown nationally and locally. There are over 92 million Americans on Medicaid. And in DuPage County, our insured rates are really strong. 93% of adults are covered, 97% of kids are covered. But nearly 1 in 5 are on Medicaid. The most recent data we have from HFS, state fiscal year 22, show over 165,000 DuPage residents are on Medicaid. That's a 25% increase over the past 5 years, more than 33,000 additional residents on Medicaid. And this is important because our role at the health department is to be a safety net provider, support our members of the community with lower incomes. That's always been our role, but we've only seen the issues affecting their access to care worsen, not improve. We know the complexity of our insurance systems. That's only more difficult with Medicaid. We know that there is a lack of treatment providers, and we know that the cost of healthcare only rises. At the health department, we provide services almost exclusively to Medicaid clients across all our clinical programs. When it comes to behavioral health, we're also designated by the state of Illinois as the largest community mental health center in DuPage County. So that combination of factors, what that means is there are more residents eligible for our services, more residents in need of our services, and it's our responsibility to serve them. So we'll lean into behavioral health and mental health a little bit this morning. I've been a big fan of the information that the Surgeon General has been publishing over the course of the last year on mental health. And this quote certainly has stood out for me as a public health professional. Mental health has become the defining public health and societal challenge of our time. Far too many people and their families are suffering and feeling alone. So DCHD, the health department, is uniquely positioned to make a difference here. Again, mental health and substance use would be the defining public health challenge for us just as a local health department, as that chief health strategist that I was talking about, even if we didn't happen to also be the largest community mental health center in the county. So considering that combination of factors, we're very clear-eyed about the incredible task that we face to be both a system and thought leader on this issue at the population health level, but also delivering care, critical behavioral health crisis services to the members of our community in their moment of greatest need. So, mind of its own. So what are we doing about it? We're doing lots of things. We're not new to this work. Some of you may recall a very busy slide from my presentation in June where I tried to map the whole history on one slide. It might have been a bit much, but really the point is our work dates back to the 1960s when we opened our first crisis hotline and our first mental health clinic. We've really stepped up our services and expanded over the last decade under Lori Carnahan's leadership. She's overseen an expansion of services across our continuum of care, leveraging competitive grant writing, increases in both state and federal funding to expand youth services, adopt and grow substance use services, lead innovative pilot programs with local leaders across law enforcement, healthcare, the court system, and more. Lori has led internal efforts to strengthen our suicide prevention work, to expand our 988 crisis call center, and to grow our mobile crisis response teams. So supporting our police officers in the field and serving residents in the community. And now, of course, as you see here, we're on the brink of some incredible innovation with the development of the Crisis Recovery Center. With many thanks to so many local partners and leaders, including this board, our Board of Health, the Health Department leadership team, my predecessor, and of course, Chair Conroy. We are now positioned to do this, and we are thrilled with the opportunity to deliver this model for the community. But it is critical we recognize this is an emerging model and we are in an innovative space. That means the plans and designs are outpacing the existing regulatory standards and funding models. So this means that while gratefully funding has been secured to build the facility, we know even more will be needed to prepare for, to launch, and to sustain the operations. Such investments will allow us to deliver a best practice comprehensive model to deliver crisis care to our residents. So this image might be familiar. You've seen this. We've tried to get this out there quite a bit. We really feel like this best represents what the ideal behavioral health crisis system looks like in a community. It represents that national best practice model that we've researched and understood well, of someone to call, someone to respond, and somewhere to go. And we will be the first in Illinois to establish this type of comprehensive system. So while similar concepts exist nationally, no two are exact. We're focused on delivering a model that fits the needs of our community while aligning with those national best practices. Development of this type of model at this scale requires robust stakeholder engagement, strategic partnerships across multiple sectors, and we'll talk a little bit about that, but it is undoubtedly a bold vision. We are designing an alternate care pathway for our residents at a great moment of need. So getting almost to the budget detail for you here, but I just want to take stock of where we are with this big project sort of globally and on that timeline. We're on the back end of phase 2. We've been focused on the program and facility design plans most recently, both of which directly inform our cost projections, which of course we're actively working on as well. The progress we're making on the programmatic and facility designs has really enabled us to get a healthy head start on our staffing and our sustainability plans. 5- and 10-year operating plans with the financial sustainability strategies are in development. They are progressing, and I anticipate and hope I can come back in early 2024 with even more detail on that. And as you can see, this is the top priority for the project in phase 3, the sustainability development, along with other major milestones you can expect next year, including our groundbreaking in the spring and still on track to open in the summer of 2025. So our core budget elements, and there was a lot of material emailed to you late last night. I'm assuming you weren't able to read 264 pages between now and then. I go back. But a few highlights that I'll call out for you. Some assumptions. Our revenue projections are actually built on conservative estimates and our known contract awards. The only increases we see is a 1.5% CPI escalator for environmental health fees only, and then that mirrored increase regarding the tax levy for new construction only along with the county. For expenditure trends, we've built in a 3% salary increase for staff. It's based on staff performance, and an increase in the IMRF rate contributions. And this is all based on the analysis of the trends and the grant spending plans that we have from our finance team. But both revenue and expenditure, our assumptions acknowledge that DCHD's top priority will continue to be seeking new revenue and refining our revenue cycle management practices. So this is sort of that top line of our core budget. And I'm going to make a couple differentiations for you here. So our core budget totals over 57 million. It's a just over 2% increase from the year prior. And our core operations are rather straightforward. That was kind of why I highlighted some of the things that we're doing on a day in, day out basis with communicable disease and environmental health. That's pretty straightforward, but you'll notice a unique aspect. $850,000 listed as TBD revenue there. That's what represents both the big challenge and opportunity that I have to discuss in greater detail with you this morning. So with the core operating budget being over 57 million, what's important to note is that's exclusive of our grant applications. That's exclusive of ongoing COVID operations. We are still doing, even though the worst behind us, we're still doing some vaccination and we're still doing disease surveillance, and we have state funds for that work. And it also is exclusive of most of the expenses related to expanding behavioral health services next year in advance of opening the CRC. The CRC construction we know will start in 24 is to be financed with a combination of federal funds, whether that's SAMHSA or ARPA, state funds from DECIO secured by Chair Conroy, and local dollars from DCHD's budget. Efforts to secure a variety of funding streams and investments to support those operations continues to be our top priority. Here's the fully loaded budget. So when you look at it, that number is much larger, right? It's 135 million. So there's a few important notes. The first is the $50 million for grant apps. It's really a placeholder. It's allows us the spending authority up to that amount, but only when we get grants or funds in that amount. So it's money in, money out. Basically, we learned that lesson the hard way during COVID, that we set that number too low. We had to bring an amended budget back to our board and back to you in the middle of the year. And so we've learned to just set that number a little bit higher. But it's got a mind of its own this morning. But the examples on the left that I showcase that practice and why that's important. We had just gotten done developing our budget for this year, presenting to the Board of Health, and then we learned of 2 federal awards that we got at the end of September. And so that's just illustrating that practice for you, that those are now then covered in that grant apps line. So that 50 million is sort of a big placeholder number. But that increase is also in the fully loaded budget includes the 19 million that we anticipate spending on capital projects. So again, both the construction of the CRC, as well as completing remodeling of our existing facilities, mostly focused again on expanding behavioral health services now. So returning to that 850,000, that amount represents strategic investments we hope to make in FY24 to ramp up for the CRC on the staffing side. This investment will support a head start in onboarding positions that will ultimately staff that facility. But we want to get that head start. We anticipate needing at least 40 more mental health professionals by the time we open the doors in the summer of 2025. That's a lot of recruiting. And so we want to give ourselves sufficient runway to be successful in running 24/7, 365 when we open those doors and start ramping up next year. So we would do that strategically. We would have a phased approach. We would add maybe about half of the positions we're looking to add over Q1 and Q2, and the other half over Q3 and Q4, sort of gradually over the course of next year to get that ramp up going. But they would, importantly, they would allow us to expand services to residents immediately. So we would staff with positions like psychiatric nurses and emergency services counselors that can integrate into our existing work and facilities while we're building. So I've talked, I think a few times I've mentioned top priority is looking for new revenue, securing different funding sources, and making investments now in this innovative space that is the build up to the CRC and the ideal behavioral health crisis system. One initial investment and funding opportunity we're seeking for support of this early CRC operational development is from this source, from this incoming opioid settlement funds for DuPage County. Our team has reviewed and collaborated with the state's attorney's office to identify and confirm that these are permitted uses, that these are eligible uses. The staffing plan we're developing for a crisis diversion center qualifies. So we're interested in a portion potentially being used to support the expansion of behavioral health staffing in fiscal year 24. We believe this is an appropriate and effective use of these funds. It extends services now to residents, and it also supports our longer-term behavioral health goals. Okay, so I got the notes last week about presentations being a little long for you guys, so I try to go pretty quickly for you, but I'm certain there will be some questions. So,
okay, yeah, we'll open up to questions. Member Krajewski, Member Cahill, Member Rutledge, Member Childress, and Member Dessert.
Thank you for the presentations. A couple of quick questions. I saw all the detail in here. The only thing that I don't have, and you can get it to me later, is what you actually spent this current year, because this is all just comparing a current year budget projection to last year's budget. And one thing I know is whatever last year's budget, the numbers you have here is not what you actually are going to spend. You may be close, you may be 2% under, which would be you're gonna have a 4% increase. So I have no idea what the actual ending this year looks like.
okay.
Do you have an idea? Are you close to the budgeted numbers that you budgeted for this year?
Could you please come up to the microphone?
Because all I'm looking at is, even the details, all just last year's budget, and we're projecting this year's budget. And one thing I know is last year's budget isn't what you actually are gonna
Let
spend.
the expert answer for you.
Oh, yeah. We, the materials that were loaded last night, I believe, have some actual history, and they have actuals through the first 6 months of this year and projections for this year.
Okay,
So
yeah,
that should- that
I
should be
didn't
out.
see it. I mean, I'm going through these 200 and some pages, but it just all looks like.
It should be
budget.
at the back end of what was loaded.
Okay, I only got through like pages 100. Okay, so the actuals there.
The very back end
Now,
of what,
what's the answer though? Are you guys gonna be close to what you budgeted this year? With your actual numbers that are gonna come in, what are you projecting?
we're gonna be close,
You're gonna be close, okay?
close. We're gonna be below, but we're gonna be close. In terms of, I mean, that's kind of a broad question in terms of,
Well, I just wanna know, are you gonna be 1% under your budget, 2%, a million, 2 million less than what you actually budgeted
we're
last
gonna
year?
be more than 1 or 2% under.
Okay. So really, this current budget we're asking for is like a 4% increase on what you actually are gonna spend.
Potentially, yes.
Okay, because that's what I'd like to know. It's like, actual is what I like to compare things off of. So if you're gonna be 2 million short, then you're asking for the current budget a lot more. So that answers one question. Thank you. And then the 50 million grants the placeholder, how did we do this year? As far as what do you think we're gonna have as far as grant money?
We didn't come close to hitting that. That's, again.
No, I understand that. Just if we get the grants, we do more programs. If we don't, so I was just curious.
We had another folder or something like that.
That's fine. And then the last question, the 45 million of personnel that we budgeted last year, was that 100% of the budget of personnel, assuming we had all head positions filled? Or do you discount that a little bit?
No, it's just-
We discount that a little bit.
What percent?
4.
Is that what we use here too, Jeff? About 4 to 5? For the personnel, we don't use a full 100% of personnel, assuming every position is filled. Oh, the big departments, okay.
Percentage.
Let's say the big ones, like the health department, the sheriff department, state's attorney.
Sheriff's Department, we take it by department and go through their head count with them literally one by one.
Okay, and then
So
assume, but
It's a very detailed approach.
we don't take 100%. It's
We have not budgeted 100% head count for quite a while.
Is it about 4% less or?
Oh, geez, in total, we're down about 120 positions.
I get the number player, but that sounds about, so it's about 4%.
Yeah.
Okay, all right, thank you.
Thanks, Mike.
And I'll get through I know the first 100 and some pages is just the budget, so I'll see if there's.
Sure.
more.
Yeah. When you get to that number, we can always answer more questions
Thank you.
offline. Yep, absolutely.
Oh, and the last thing, the ARPA money.
Yep.
I know there's a lot of extra ARPA money that you didn't use. Are we moving that to the building?
Yeah.
The-
Yes. Yeah. So all of the ARPA funding is being allocated to the
the
capital
new building, okay.
project. So that will be,
the money you got for all the stuff that we didn't actually spend is just gonna move over towards the building.
that's correct.
Okay,
Yep.
thank you.
Should be all expended in 24.
Perfect.
Okay, thank you, Member Krajewski. Member Cahill?
Yes, thank you. The ARPA question was one of my questions and that's been answered. Thank you. The second thing is regarding the opioid settlement funds. What's the timing of that and how much are we going to get on that?
So I think I'm gonna have to ask the state's attorney to comment on the totals and the schedule. And I know some of it's fluid and still in development.
So currently, the county has collected 2,219,000, a little bit over that. We expect over the course of the next 15 years to get anywheres from another $10 to $20 million.
Wonderful. Thank you. And then one other question, just on the revenue side, the intergovernmental amount this year from 22 million to 41 million. Can you explain that?
Yes. Yeah, that's the money for the capital projects.
Okay.
Hey, thank you, Member Cahill. Member Rutledge?
Thank you, Chair Chaplin. Member Cahill answered or asked my question about the opioid money, but I'm curious about the investment income line that jumped from 64,000 to 700,000. And I want to know how you did that and how can we do that across the board?
Well, the credit, I think, for the increase probably belongs with the treasurer's office. We budget very conservatively on that and did previously. What I understand, working with the treasurer recently, there's been some real success in looking at different options and proactively managing that. So yeah, I think we budgeted conservatively and we worked with the treasurer and we're seeing much greater returns.
Thank you, Treasurer's Office.
Yep.
Okay, thank you, Member Rutledge. Member Childress.
Thank you, Chair Chapman. Just a quick global question. We are probably 3-4 weeks away from government shutdown, and I think you've mentioned grants. Well, is what's going on in Washington going to affect what we do here in DuPage County at all?
The only direct impact that we actually assess when this happens, and we were almost on the brink of it a few weeks ago, is actually to our WIC program. The state WIC does a decent job of creating some protections and some buffer for when this happens, but they were pretty direct with us that they would run out quickly. So that's an area where we're proactively assessing what would that mean and what communication to our residents and clients who are on the WIC program would they see? But that's probably the top area that we're focused on if we experience a government shutdown.
Okay, thank you.
Thank you, Member Childress. Member
question.
Dessart.
Thank you. And thank you for that wonderful presentation. It was awesome. I have 4 quick questions and I have to say, I did not see the late arriving email from last night. So maybe the answers are in there, but no, on page 10, you mentioned seeking new revenue. Is that the TBD revenue? And what is that?
So seeking new revenue, I reference globally as top priority for getting ready for the opening of the CRC.
But what is the new revenue? I mean, where are you going to get the new revenue? I'm not
So-
saying how it's going to be spent. I'm asking, where is it coming from?
Yeah, well, that's the $1 million question and what's keeping me up at night. For the 850 for next year, that's the connection I'm making on opioid settlement funds that I would seek as much support. It's the board's decision on what to do with opioid settlement funds, but I would welcome and seek as much support as possible in closing that gap. That is,
going on with that conversation, the state's attorney just said that we got $2.2 million in opioid settlement funds. So the 850,000 would be, almost tripled.
yeah, you would still have significant funds left over beyond the potential ask I'm making to determine what to do with as well. The health department's certainly well positioned to help the board with that process. Chris and some others from our team worked with the state's attorney and attorney general actually previously about a year ago and working with community stakeholders to identify potential uses. So we're pretty well versed in what we could do, what the board could do. But those decisions are to be determined.
Gotcha. Okay, thank you. My third note is you mentioned remodeling the existing facility while we're building a CRC. That sounds a little bit ambitious to me. Could you explain?
Yeah, sure. So it is ambitious. It feels ambitious. Our team's feeling it. But what we found is that the demand for mental health services is now and is sharply felt now. And so if the only thing we're doing is waiting for the doors of this to open in 2 years, we're really missing an opportunity to expand services now.
And where's the money coming from?
ARPA.
ARPA funds. Okay,
Yeah.
thank you. And finally, member Cahill did ask about the opioid settlement funds. And so state's attorney Bob Berlin, you said that DuPage County has already received 2.2 million. Has that money been spent, in part spent? Is it sitting in a savings account ready to use? I mean, we know the opioid crisis is a huge crisis throughout the country, let alone DuPage County. So are we using that money yet, or is it just in a fund?
None of it has been spent yet. It's in a designated fund.
Okay. Okay, thank you. So we're earning interest on it.
Yes.
Okay, thank you. All right, that's it. Thank you so much.
Thank you. Thank you, Member Dessart. Member Guston, and then I do have Member Zay after that, and then Member Garcia. So Member Guston, go ahead, please.
Thank you, Madam Chair. Director Forker, thank you very much for a very comprehensive presentation, short, to the point, and I really appreciate that. You did say an ounce of prevention is worth a pound of cure, and that's really where my focus is at. If we can get to those younger individuals who have not and need to be educated about things that are not healthy. And I'm wondering if there is a conversation or a thought process about having a pilot program with our schools to be able to help educate and provide information to our young people, because it does cost a lot more when they're already in, in crisis versus being able to provide them services and having some type of conduit with our young people in our school system. So that's number one. Number two is we talked about hiring employees, full-time employees, which is great. The question for me is, how do you identify between how many full-time employees you're going to want and then maybe contract employees where maybe counseling for mental health and substance use might be more of a Zoom concept? Because I know a lot of counseling services are now doing more of the Zoom because they can get people together at the time that they need to get them together. So would really like a little bit more information of the thought process of how you decided more on-hand staff versus those individuals that will be able to provide that counseling through technology. The other thing was, I was surprised to hear that 1 in 5 are on Medicaid. The one thing I'm wondering about, we do have different municipalities, different villages in DuPage County. And some of the response that I have heard from them with respect to the Crisis Recovery Center is its location, and that it is not effective for them to participate because of location. I don't know what the answer is, but we really need to have a conversation about that because I think this is going to be an asset for everybody in DuPage County. I'm just not sure how you get there.
Sure. Yeah.
Okay.
Yeah. So I'll take the last one first. I think that is the trickiest. We've talked about this challenge of location and transportation a lot already and recognize that it's probably the top challenge. What we know is that we still believe that we're going to make enough of a difference for surrounding communities that this needs to be the place to start, right? The reason, the idea that location and transportation is a challenge is not a reason to not do this. We've got to start somewhere and then work around that and rally around that to have solutions. We're looking at what are transportation options that could support this facility directly and transport 4 people at distances in the community to us. But we are having those conversations, and I think we're scheduled in 2 weeks to talk to the Mayors and Managers Conference. I know this is on the agenda. So I think that one thing I would point out for you and for them is that we believe that as the model develops and is implemented, we're going to see those benefits in real time and understand that maybe the trade-off that an EMS or police, the time they're spending dropping someone off at an ED that's close by, but they're at that facility for a long time, might end up being actually a little bit of a wash for a longer drive, but a quicker drop off with us. That's the kind of thing that needs to be evaluated, and we'll see, but we do believe that the model is worth pursuing in the face of that very real challenge. And there will be, I think, lots of creative conversations about what those solutions should be. And again, we believe we got to start somewhere. I will say full-time versus contracting, a couple things. First, our staff actually can do telehealth now. We can Zoom and deliver services via telehealth to residents now. I think in general, our philosophy is we prefer to bring staff on board because it's a more efficient management, right? We have fuller control. We can deploy those assets and resources to whatever we need. When we talk about emergency services or crisis counselors, they can do a full range of services. And so it's better for us to kind of bring them fully on board rather than contract out. Now, I will say, though, there is still a place for contracting, particularly when There's difficult positions to hire. We're having a hard time recruiting. They're high in demand, they're specialty, and we do have some contracting that we do for those situations. Lastly, pilot program with schools. Yes, I think there's a lot of work we already are doing with schools that we should make sure to get the board some summaries on that. But we partner with Amber and through prevention leadership team, which Amber serves on, we're integrating with schools more and more, and we're focused on that prevention work. So I love that question because that's the heart. Well, like I said, if there's one thing that you guys take away, right, it's your health department is working on those two levels at all times. We are doing that upstream prevention work, and we're the safety net. And so we know we have to do both.
And the last question, vape settlement. I know there's been an article I read that the Juul company was sued, and there is some type of judgment that has been passed. And I know some of the school districts were part of that lawsuit. So that's something you guys might want to take a look at also.
Sure.
Thank you.
Yeah, I'm not familiar with
Yeah,
that. Thank you.
yeah, that's a rough one. Thank you. Thank you.
Thank you, Member Guston. Member Zay?
Thank you. Thank you, Madam Chair. Good morning. You know, I've seen a few budgets. This is the first budget I've ever seen with 850,000 to be determined. That's not very transparent. You tried to explain it. If you could, again, give me an explanation, because, you know, my concern was when we were ambitious and you're doing the CRC, it was kind of, we're going to build it and figure out how to pay it. And it doesn't seem like we're any closer to getting really the answers of how we're going to pay for staffing this. Like you said, you're going to hire 40 employees starting next year, but it doesn't seem like there's a revenue stream or a certain path that's going to be to pay for this over the future. And opioid settlements are great, but I don't think that's what you're looking for to fund this the whole time. And if you can explain 850 again, and I know you're working on it, but I would think that line should be changed to something more transparent so the people know. To be determined is pretty vague.
Absolutely. Yeah, I understand. Great question. I think that the 850, so being transparent with what it's for, it is hiring certified medical assistants, psychiatric nurses, crisis counselors, resident assistants, peer specialists. That's the bulk of that. That's hiring positions that are mental health professionals that we would onboard over the course of next year, start delivering services to residents in existing programming and facilities next year, and be that ramp up and runway for the core staffing when the doors open in 25. So that's what it's for. In terms of the source, it says TBD because it truly is TBD. I'm making an ask essentially this morning for some support from this board of opioid settlement funds. If the board does choose to approve any amount for this between now and the time that the full budgets are passed, we would list that source. I think your question is, again, absolutely a fair one. And I think that my board, the Board of Health, is also prepared to help fill that gap depending on how this board feels about producing some opioid settlement funds for that purpose. So you can see in our budget material, there are certain reserve funds that my Board of Health is, they passed this budget already a couple of weeks ago with this understanding that we're having this conversation, and this will be ongoing for the next several weeks. And then I will regroup with my board if we decide that the opioid settlement funds are not appropriate use for this at this time. Your bigger question, yeah, again, I agree. And I mentioned to Member Dessart, it's what keeps me up at night. And it's my great task of the next year and a half is figuring out the overall sustainability plan. We're working on it. Right now we're looking at a budget gap if we open the doors of about 3 million a year. We're working on several different strategies that we are confident will close that gap over time. Like I said, when we're in an innovative space, this is kind of what it takes to innovate. A little bit of uncertainty, a little bit of discomfort, and finding the ways together. So I do have a list of about 12, 13 different strategies that we're pursuing and developing. And they're just not ready for showtime with you guys just yet. But I like I mentioned before, I'm happy to come back in early 24 with that plan more fully developed. We have a preliminary 5 and 10-year operating plan in development. And I think that we're optimistic about a lot of those opportunities.
And I appreciate that, but that's the difference between business and government. as a business owner, I can't just say, hey, I'm gonna go buy a bunch of machinery and hire a bunch of employees and hope the business comes in and I'll figure out later how to do it. That doesn't happen. And, you know, we all know if families are hurting out there right now, and I think they're looking to us to say, hey, we have a plan and this is what how we're gonna pay for it. And we know it's a need out there. But again, I think there needs to be more of a strategy before we break ground and commit to this. And now you're saying you need 850 this year, but then you're gonna need 3.5 to 4 million. I mean, it just keeps escalating. So I've got faith in you guys to figure it out, but it's at some point we've got to, you know, put it to the paper and have a plan. So thank you.
I understand. Yep.
Thank you, Member Zay. Member Garcia.
Thank you, Chair. And thank you, Director Forker, for your presentation today. I am very excited and very supportive, as you know, about looking for getting more of the mental health staff on board earlier than later. I know right now there is such a hard time getting staff on board for this need. And this need is so great right now. And I think if we wait and decide till everything's put together, nothing will ever get done. That's just how I feel. You have to have a vision and you have to get going with it. And I'm very excited about the CRC, but I'm even more excited that we're going to start with the treatment as of next year. So I just wanted to say that, you know, I'm totally in support of the opioid funds being put toward this. I think this is a use that's a great need in our county as of today. So thank you.
Appreciate it.
Thank you, Member Garcia. So let me just go through my list here. I have Member Schwarzy, LaPlante, Eckhoff, and Member Ozog. So Member Schwarzy, oh, and Member Galassi.
Thank you, Madam Chair. Thank you, Adam. I just want to share with this board that I'm absolutely a strong proponent of using opioid settlement funds for this cause. That's exactly what what those funds are meant to be used for. And the health department has been a very, very active player in the Hope Opioid Task Force for the past 5 years. They work with all the stakeholders that are involved, and they've done a wonderful job working in that setting. And so I'm sharing my thoughts that I would like to see that money used for this purpose. So
Thank you, Member Schwarzy. Member LaPlante.
Thank you, Madam Chair. Director Forker, I would just like to say thank you for really drawing our attention to the macro level here, to zoom out, to show the bigger picture. And I just want to highlight the fact that not only is this project and everything that you have planned definitely innovative for the state of Illinois, it is innovative for the nation. And to sort of paraphrase what you were saying and to emphasize it, in order to be an innovator, in order to be a leader, and to create something brand new that's never been done, sometimes you don't have every single piece of information there in place simply because it's never been done. So I applaud the creativity, the way you're approaching this, and the really big scale thinking. This is what it takes to innovate. And that is the difference between, let's say, that is often an approach you see in business and in government. I wish we had bigger thinkers like this all the time, because this is how you make real, impactful, lasting change. And I'm very proud of the initiative that you are putting forth, and I support it completely.
Thank you.
Thank you.
Thank you, Member LaPlante. Member Ozog.
Thank you, Madam Chair. First of all, thank you so much for the presentation. Great job. Want to point out that Mr. Berlin already talked to us about 15 million or 15 to $20 million over the next 10 years for the opioid settlement. So I think that takes care of a third of your deficit, if I'm reading that correctly. The other thing I want to point out is that we are not a business, we are government, and we don't operate under a profit motive. And our job is to spend taxpayers' money as responsibly as we can and to help the people who fund our activities. And this is a prime example of where we will be helping the community with a crisis that's really been going on for years. When my son was in high school 15, 20 years ago, they were bringing parents in to talk about heroin. At that point, going into the opioid crisis, this is not going away. So this is a really great example of the work we should be doing with taxpayer money. Thank you.
Thank you, Member Ozog. Member Eckhoff, did I call on you yet? Member Eckhoff? And then member Glassy. Yeah, I have you on my list. I'm sorry.
Two items, a couple of people have touched on. Number one, I'm looking at your slide number 8.
Yeah.
And next year, I would hope that you could come back and tell us a little bit more about prevention. Because I don't understand why there's such a skyrocketing number of people with mental illness problems. And were we doing something in the past that prevented it? Or more factors, social media, whatever it is, in our society that's causing this. And what, veterans, maybe they need it, school kids, whatever it is, what are we doing to try and head it off at the past? And number two, and this is my annual talk about the 708 boards in townships. That there's a couple of them. Milton's got one, Bloomingdale's got one. We need to coordinate with them. I'm still in favor of a countywide 708 board. And I've tried to talk to a few groups to work on that, but obviously, to the extent that we can have some economies of scale and you can coordinate with them and use the money they're spending, that would be a big help.
Yeah. So yeah, I agree. Second one first for me. I agree. We are active in discussions with some of the 708 boards. We tried to pull all of them together a couple times with some success. So discussions are ongoing with how we can better coordinate. Whether for us, it's whether that coordination is both of funding, of course, we're interested in that, but also even just how we all work together, right? We don't want a bunch of CBOs all doing 5 different applications for the same thing. We don't want everybody looking at different data sets. So we are trying to proactively coordinate with 708. So I appreciate and agree with that comment. Prevention. I mean, you're asking the big question there. The mental health crisis we're experiencing, it's multifactorial. It's not new. To Member Ozog's point, I think what we're seeing is a combination of factors all at the same time. We're seeing the effect that the pandemic had, sharpening that. I think you hit the nail on that with social media. I'm a big believer that the smartphones and the social media is causing significant issues that we're just beginning to start to understand. And that's why I really like to give a shout out. I did for my board as well, for the Surgeon General. I think he's published a lot of material this year and wrote a book even that are really about how the lack of social connectedness is driving a lot of the mental health issues that we're experiencing. And I subscribe to a lot of what his theory is on that. But I also think, what I mentioned at the very start, that there is also this progress that's happening culturally, which is there's more openness and willingness to talk about this. And so it's somewhat of a sampling bias in that respect that, okay, well, now that we're more comfortable and we've done a good job of talking about it and being more open and saying it's okay, you've got more people seeking services. Now, I still believe that's a net positive, but I think that that's one of the factors. And so we got to do more on prevention and crisis response.
Thank you, Member Eckhoff. Member Galassi.
Thank you, Madam Chair. I just want to echo a few comments that other board members have mentioned. Being a representative of District 3, you did talk about the transportation issue, but I did just want to echo that at our last mayors and managers dinner, every single mayor mentioned this. They were all very concerned and said that they were, not even in support of the new building because it was just going to be so difficult. It takes me 45 minutes to get here in the morning. So, they have small police staff and they just said it's, going to take a police officer out of their daily routine for most of their day. So I just did want to reiterate that. I understand, it's a concern and you're working on that, but please know that was their, every single one around the table mentioned that. I also wanted to echo what Member Krajewski said. I didn't get to the 200 pages that you sent last night, but I would love to see this budget compared to the 2023 actual, because I think that's the best way to evaluate a budget as opposed to budget, like he mentioned. And then finally, just because there is a shortfall, the 60,000 to 700,000 in projected investment income, is that because of the opioid money that's been received that we haven't used? Or, that just seems, I know Member Rutledge mentioned this, but it just seems like a huge increase. And that if we're already in a shortfall, that seems like a lot to be projecting.
Yeah, I think it really is just how conservatively we budgeted the investment income previously and how much the market changed and we were able to work with the treasurer on additional options for investing that money and just had really good, I mean, we went back and forth on this. We might have been able to budget even higher on that investment income, but it seemed like too much because that jump is already so significant.
Well, then you mentioned that it was too conservative for 2023. Do you know what the actual has been the first, 6 months or what? I mean, was this if you only
Our
budgeted 60, was it much larger than that
Our
in actual?
actual investment earnings so far for FY 23.
Correct.
I know it was more than that. I don't have the number off the top of my head.
To the microphone.
It's both strategic plans that the treasurer worked with the treasurer on, in addition to the market. The market's been very good.
Do you know what the actual is today?
It's $1 million, it's over $1 million, $1.5 million,
Oh.
somewhere in there.
Okay, well, that makes me feel better. Thank you.
Thank you. So, okay, before we call on people for a second, we really have to get through this because we have a full agenda of the budget items too, but Adam, just for clarification, so this shortfall that you're looking for, are you looking for money from the opioid crisis or are you looking for money from the county?
I would apologize that it's not more clear by now. Yeah, I'm looking for whatever amount of the opioid settlement funds this board would feel is appropriate for helping me fill that shortfall. That's what I'm looking for. I'm not looking for any county taxpayer dollars. I'm not looking for general revenue fund dollars from the county, just an amount that might be agreeable from the opioid settlement funds.
And would it be the whole 850 or would you do part from the opioid and part from your reserve?
I've been advised to leave that open to the will of the board.
Okay, thank you. Okay, and then just one thing, I know there's been concerns from the mayors about, the distance of the crisis center, but in truth is every day the police departments are taking people to the county jail. So I don't really know what difference it is going from the county jail or to the county crisis center. It's the same. They would take that person either to the jail normally, and instead of taking them to the jail, now they'll take them to the crisis center. So I think I'm not sure how that are they taken to the ER? Okay. Okay. Thank you for that. Thank you.
I don't want to be dismissive of that concern.
Yeah.
We're
it
committed
is.
to working with the mayors through this issue. Transportation's an issue across the county. You guys know that maybe potentially better than I do for a lot of things. And this is one of them, but we're committed to working with the mayors on this.
Okay, thank you. Thank you so much. Thanks for the thank you, Member Glassy, for that clarification. And also, okay, Member Krajewski, Member Guston, and then we're wrapping this up because we have a full agenda. So go ahead, Member Krajewski.
And this is great, all your detail, because you break it out by departments, but I'm going to focus on this 2252, this vision one, because it goes to my small grants in my district with the Lions Club wanting to do the vision and eye care for low-income students, and having fights with the state's attorney saying something we don't do under the statute, but yet we have a program. But your vision program for this current year, shows a shortfall of like $350,000 in your current budget. And it looks like from last year, you only had like 40,000 as salary, and now it's projected to be 90. So it looks like you hired another person, which is good. It looks like you got 2 people there, but I'm having a hard time with your part-time help. It's like $500,000. And I don't know if that's a real number because you've never used that amount in, nothing more than like 60 grand. And then the question, if we are spending $250,000, should you get another full-time person? That's just, I don't know if you don't know the answer, I can. Yeah, just get back to me. But it's your 2252. I'm looking at actuals for the last 5 years, and you're projected for the current year, and you have a shortfall of 350,000 for vision in that program. But your current year is projecting a $350,000 loss. So clearly we don't have enough. Just get back to me on it. But we're short a bunch of money, but yet we have a huge number for part-time help. So maybe we need full-time. And we've never spent that part-time help. I'm looking at the most.
We'll get under the hood on that one.
2252, you can email me back. Just let us know. I don't need an answer now. Thank you.
Can do.
Okay. Just a reminder, since Member Zay is on Zoom. He's having a hard time hearing, so if you could please move
Speak
closer to the
louder.
mic when you're speaking. Thank you. Okay.
Quick question, if I may.
Yes, Member
Who
Glassy.
else, first off, the opioid funds that are available,
Mm-hmm.
are they specifically to be used in a certain way? Is there certain criteria on that? You don't have to tell me now, you could get me later. And then how many other departments are partaking or need the opioid money? So what else is where else is that money being spent?
Yeah.
Those are the two questions I'll have.
I think those are pretty easy. Yes, there are very particular uses outlined in the settlement agreement. We can get you that information. And my understanding is so far, no, there's no other ask or request that has been made of the opioid funds. Correct.
Thank you. Okay, thank
Thank
you
you.
so much, Adam. We
Yep.
really appreciate you coming and
Thank
giving a presentation. Thank you very much. Okay, next up, we have Anthony McPherson with our informational technology update. Morning, Anthony.
Good morning, Chair Chaplin. Good morning, board members. How are you? Good. Just wanted to take a couple minutes of your time to update you on what's happening with our move to a .gov domain. A year ago, you guys know, we implemented a new website, and as part of the new website implementation, we changed our domain from a .org, which is usually associated with nonprofits, to a .gov, which is a certified government domain. That was phase one. Now we have moved on to phase two. The team has been working over the past few months to plan this out, to test the change, to make sure that all users, including yourselves, are minimally impacted by the .gov move. So it leads me to where we are today. I'm happy to say that we are moving forward with moving all email addresses over to DuPageCounty.gov. We started a few weeks ago with the information technology department and have successfully migrated quite a few of our departments over as well, with no issues. So now it leads me to you guys, and wanted to give you a few bits of information that'll help you with the transition. Number one, what's going to change? Just your email address. So essentially you'll go from, I'll use technology chair, you as an example, from ina.u@dupageco.org to now ina.u@dupagecounty.gov. That's it, right? What will not change is your username. So the username that you use, which is CB and your initials, doesn't change at all. So how you log on stays the same. So there's no impact. You don't have to make a change there. When will the change occur? In 2 weeks. So November 6th, 2 weeks from yesterday, at 10 a.m., we're going to switch you over. The process takes about 2 hours. Some of you will see the change immediately. Some of you, like Board Member Zay, may not see it until noon. The global address listing, the GAL, global address list, which you can go to look at all email addresses, that may not change for a 48-hour period because we have thousands of counts in there and it takes a while to run through and make those updates. What will you notice? Absolutely nothing. So the switch happens behind the scenes. You won't notice it at all. Who will notice it are the people who receive your emails. So instead of them receiving the DuPageCo.org email from you, they'll now see DuPageCounty.gov on the back of it. Most people won't notice at all, but that's the only change. What should you do to make sure that everything goes smoothly? Just let your contacts know that you're going to be making that we're making the change, and this is a legitimate new email address. Right? Some systems will notice a change in your address and they may not know it's you. They may think it's a spoof or something like that. So give them a heads up that this change is happening. One of the best ways to do it, to make sure that all folks who access your email or see your emails know about the change, is to change your signature. So there's a blurb that you can put in there that basically says that we're moving from DuPageCo.org to DuPageCounty.gov. My email's changing to that. I sent out an email to you guys yesterday that has a lot of those details, also has some examples on how you can change your signature block. If you're not sure about it, you don't want to do it yourselves, call us, give us a call, and we'll help you out and we'll help you make that change. All right, and so what happens to your old email? So the messages that are sent to your DuPageCo.org messages you'll still receive for the next 12 months. Okay, we're not going to switch over right away. We will switch over in approximately 12 months. We'll give it about 6 months. We'll see how much traffic is still coming through the DuPageCo.org domain. If there's a lot, we may extend it to 18 months total. But if there's not a lot, we'll probably sunset those email addresses in a 12-month period. And then last but not least, a lot of you may have the question, what happens to my printed materials, specifically what happens to my business cards? Absolutely nothing. You don't have to replace those yet because we are forwarding the DuPageCo.org emails to your DuPageCounty.gov email for 12 months. But if you'd like for us to order you new cards, we will. So just send me a note to say, hey, Anthony, I'd like to change my after November 6th, and we'll make sure we put that order in as soon as possible and get those to you. So that's it.
Great, any questions, Member Guston?
One quick question. So with our Apple ID, do we change it to DuPageCo.com or .gov? Or is it only in our signature line that should be changed?
Only just signature line for now.
Thank you. Thank you.
Thank you. Thank you, Member Guston. Hey, any other questions? Okay, thank you so much, Anthony.
Thank you.
Thanks for your work on that too. We appreciate it. Okay, with that, we move on to item number 6, approval of the minutes. Can I have a motion on 23/32/98 Finance Committee regular meeting minutes from Tuesday, October 10th? I'm sorry, who made the motion? Member to start, second by Member Rutledge. Any discussion, corrections, or changes? Seeing none, all in favor?
Aye.
Opposed? The motion carries. We move on to item 7, budget transfers. Can I have a motion on FIR 025823 budget transfers from 10/24/2023 various companies and county units? I have a motion by Member Garcia, second by Member Galassi. Any discussion? Okay, all those in favor?
Aye.
Opposed? Okay, the motion carries. We move on to procurement requisitions. I will call on Member Tornatori. Can you take this then, since Member Krajewski is not here? Would you mind? Finance procurement, thank you. Oh, your microphone, please.
Sorry. Move approval of 8A1 23-3403, a decrease in closed purchase order 5630-1. Serve issued to DuPage Legal Aid Foundation, and the contract has expired.
I have a motion by Member Tornatori, a second by Member Rutledge. Any discussion? Member you?
Were they able to finish the services that we had contracted them for, and will the contract be renewed?
Okay, we have Lisa Smith from the State's Attorney's Office coming up.
Yes, thank you for your question. They are continuing providing the services. This was just the first, we have to renew it each year. So this was just an older one. So yes, they're continuing to provide services.
Thank you, Lisa. Any other questions? All those in favor?
Aye.
Any opposed? The motion carries. Member Tornatori?
Thank you, Madam Chair. Move approval of FIP 18-23, approval of an agreement with Rock Fusco and Connolly LLC to provide legal services as special assistant state's attorneys for a time period of October 12th, 2023 through November 30th, 2024 for the state's attorney's office in an amount not to exceed $150,000.
I have a motion by Member Tornatori, a second by Member Cahill. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Thank you, Member Tornatori. We move on to Human Services, Member Schwarzy.
Thank you, Madam Chair. For items 8B1 through 8B5, I move to discharge committee.
I have a motion by Member Schwarzy, a second by Member Galassi to discharge committee. All in favor?
Aye.
Opposed? Motion carries. Member
Thank you.
Schwarzy, please proceed.
I'll move to approve item HSP 7623, awarding resolution issued to Comfort First Insulation and Energy Solutions, Inc. to provide architectural weatherization, labor and materials for the plan year 23-24 weatherization program for the period of October 30th, 23 through November 30th of 24 in the amount of $265,567.
I have a motion by member Schwartz, second by member Garcia. Any discussion? All those in favor? Opposed, motion carries. Member Schwartz.
Thank you. I move on item HSP 7723, awarding resolution issued to Nortec Environmental, Inc. to provide mechanical weatherization, labor and materials for the plan year 23-24 weatherization program grant for the period of October 30th, 23 through November 30th of 24 in the amount of $663,919.
Motion by member Schwartz, second by member Garcia. Any discussion? All those in favor? Opposed, the motion carries. Member Schwartz.
Thank you. I move on HSP 7823, awarding resolution issued to Arcos Environmental Services, Inc. to provide architectural weatherization, labor and materials for the plan year 23-24 weatherization program grant for the period of October 30th of 23 through November of 30th of 24 in the amount of $265,567.
Motion by member Schwartz, second by member Garcia. Any discussion? All those in favor? Opposed, motion carries. Member Schwartz.
Thank you. I move on HSP 7923, awarding resolution issued to Healthy Air Heating and Air, Inc. to provide architectural weatherization, labor and materials for the plan year 23-24 weatherization program grant for the period of October 30th, 23 through November 30th of 24 in the amount of $265,567.
Motion by member Schwartz, second by member Garcia. Any discussion? All those in favor? Opposed, the motion carries. Member Schwartz.
Thank you. I move on HSP 8023, awarding resolution issued to Healthy Air Heating and Airing to provide mechanical weatherization, labor and materials for a plan year 23-24 weatherization program grant for the period of October 30th, 23 through November 30th of 24 in the amount of $663,919.
I have a motion by member Schwartz, a member by second Cahill. Any discussion? Or Guston? All those in favor? Opposed, motion carries. Member Schwartz.
Thank you. I move on HSP 7223, awarding resolution issued to Chicago United Industries LTD to furnish, deliver, and install Energy Star appliances for the weatherization program for community services for the period of October 29th, 23 through October 28th, 24 for a contract total of $67,367.
Motion by member Schwartz, second by member Yu. Any discussion? All those in favor? Opposed? Motion carries. Member Schwartz.
I move on item HSP 7323, recommendation for the approval of contract purchase order to Medline Industries, Inc. for replacement mattresses for the DuPage Care Center for the period of October 25th, 23 through October 24th of 24 for a contract total not to exceed $49,060.
Motion by member Schwartz, second by member Childress. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Schwartz.
Thank you. I move on HSP 7523, a recommendation for approval of a contract to Valdez Supply to furnish and deliver paper products as needed for the DuPage Care Center for the period December 1st, 23 through November 30th of 24 for an amount not to exceed $87,000.
Motion by member Schwartz, second by member Childress. Any discussion? All those in favor? Opposed, the motion carries. Member Schwartz.
Thank you. I move on HSP 7423, recommendation for the approval of a contract to Pulmonary Exchange LTD for the rental of respiratory care equipment for the DuPage Care Center for the period November 20th, 23 through November 19th, 24 for a total contract not to exceed $45,000.
Motion by member Schwartz, second by member Garcia. Member Guston. Any discussion? Oh, member Cahill, you two sound a lot alike. You sound a lot alike. That's okay. Any discussion on this? All those in favor?
Aye.
Opposed, the motion carries. Member Schwartz.
Thank you. I move on HSR 6223, approval of issuance of payments by DuPage County to energy assistance providers through the Low Income Home Energy Assistance Program, HHS grant, fiscal year 23 intergovernmental agreement 23-22-4028 in the amount of $367,086.
Motion by member Schwartz, second by member Rutledge. Any discussion? All those in favor? Opposed, motion carries. Member Schwartz.
Thank you. I move on HSR 6323, approval of issuance of payments by DuPage County to energy assistance providers through Low Income Home Energy Assistance Program, State Grant Plan Year 24, intergovernmental agreement number 24-25-4028 in the amount of $4,643,841.
Motion by member Schwartz, second by member Childress. Any discussion? All those in favor?
Aye.
Opposed, motion carries. Thank you, member Schwartz. We move on to Public Works, member Garcia.
Thank you, Chair. I move for approval of FMR 00523 to rescind resolution FMP 008123 for the approval of a contract to United Door and Dock LLC to provide preventative maintenance, service, and repairs for overhead doors, roll-up shutters, gate operators, dock levelers, and revolving doors as needed for county facilities for facilities management for the 2-year period of November 1st, 2023 through October 31st, 2025, for a total contract not to exceed $209,000.
A motion by member Garcia, second by member Galassi. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Garcia.
I move for approval of FMP 008423, a recommendation for the approval of a contract to Builders Chicago Corporation to provide preventative maintenance, service, and repairs for overhead doors, roll-up shutters, gate operators, dock levelers, and revolving doors as needed for county facilities for facilities management for the 2-year period of November 1st, 2023 through October 31st, 2025, for a total contract amount not to exceed $209,000.
Motion by member Garcia, second by member Yu. Any discussion? Member Childress? Oh, your microphone, please.
What is the reason for switching from United Door to Builder?
We have Nick. Nick's coming up. Thank you, Nick.
As you can see on the first one, we rescinded. We originally awarded it, working with procurement. It was determined they did not meet the requirements of the bid. So we extended no money on that. So we need, since we awarded the original one, we need to rescind that. And then the second one is the award to the apparent low bidder at that point.
So they just couldn't meet the.
They did not meet the requirements of the bid and was determined.
Thank you.
Thank you, member Childress. Thank you, Nick. Any other questions or discussion? Okay, seeing none. All those in favor?
Aye.
Opposed? The motion carries. Member Garcia.
And finally, I move for approval of FMP 008523. Recommendation for the approval of a contract to GenServe LLC for semi-annual inspection, preventative maintenance, and emergency call-out service for campus backup emergency generators for the 2-year period of November 1st, 2023 through October 31st, 2025, for a contract total not to exceed $135,912.
Motion by member Garcia, second by member Cahill. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Thank you, member Garcia. We move on to technology. Member Yu.
Thank you, Madam Chair. I move on TEP 006723, recommendation for the approval of a contract purchase order to Infor US Inc. for ERP software maintenance and support for IT. This contract covers the period of November 13, 2023 through November 12, 2024, for a contract total amount of $203,506.51.
I have a motion by member Yu, second by member Galassi. Any discussion? All those in favor? Opposed? Motion carries. Member Yu.
Thank you. I move on TEP 006823, recommendation for the approval of a contract purchase order to SHI International Corp. For an enterprise term lease agreement with Adobe Systems Inc. for Adobe software licensing for use by DuPage County and the Forest Preserve District of DuPage County. This contract covers the period of November 10, 23 through November 9, 2024 for information technology for a contract total of $142,076.84, and the Forest Preserve will be charged back for their portion of this purchase.
I have a motion by member Yu, a second by member Garcia. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Yu.
Yes, and then I move on TEP 006923, recommendation for the approval of a contract purchase order to MHC Software Inc. for annual maintenance of the enterprise content management system that integrates with the ERP system for finance and human resources for IT. This contract covers the period of December 1, 2023 through November 30, 2024 for a contract total amount of $81,043.79.
I have a motion by member Yu, second by member Cahill. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Thank you, member Yu.
Thank you.
And we
Thanks
move
for the
on.
second, ladies.
Yeah, and we move on to transportation with member Ozag.
Thank you, Madam Chair. I move for approval of 233277, amendment to resolution DTP 0121C20 issued tonight for professional design engineering services for improvements to the bridge carrying Warrenville Road over the east branch of the DuPage River, to increase the funding in the amount of $67,650, resulting in an amended contract total amount of $533,471.10.
Motion by member Ozak, second by member Rutledge. Any discussion? All those in favor?
Aye.
Opposed? Member Krajewski, did you have a question?
Is that night even around anymore? Aren't they acquired?
Oh, Chris Schneider's gonna come up. Morning, Chris.
Good morning.
It is an exciting day. Oh, here, let me turn.
Weren't they acquired like a year?
17 years. So they were merged with WSP, a different consultant, but for some projects, they retained the Knight Engineering name. So under this contract, they're still operated under Knight Engineers.
So this contract is with Knight Inc., that corporation, which is still in existence, but who's doing the work?
The same staff. There's a lot of the same staff.
Same staff. I mean, is it being done by the company that actually owns them?
Well, it's being done. They're a subsidiary, I think, for this contract for now, during the transition, they're a subsidiary of WSP.
Are we sure about that?
That was my understanding when they announced the
Can
merger.
we just take a look at that?
Sure.
All right, thank you.
Thank you, Member Krajewski. Member Desart?
Member Krajewski only asked that question so that you could come up on your last day here at the county. So we're going to miss you, Chris. Thank you so much for all your work and all these years you've devoted to DuPage County. And again, you will be missed.
Thank you, Member Desart. Any other discussion? Okay, all those in favor?
Aye.
Opposed, the motion carries. Member Ozak?
Thank you. I move for approval of DTR 0081A23 amendment to resolution DTR 008123 for the correction of a Scribner's error in the county cost for awarding contract to Mead Incorporated for the 2024-2025 traffic signal and streetlight maintenance at various intersections within DuPage County.
Motion by Member Ozak, second by Member Garcia. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Ozak?
Thanks. I move for approval of DTP 010123, recommendation for the approval of a contract to Priority Products, Inc. to furnish and deliver weatherhead hydraulic fittings, hoses, and connectors as needed for the Division of Transportation for the period November 1st, 2023 through October 31st, 2024, for a contract total not to exceed $35,000 per lowest responsible
Motion by
bid.
Member Ozak, second by Member Childress. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Ozak?
Thanks. I move for approval of DTP 010223, recommendation for the approval of a contract with Monroe Truck Equipment to furnish and install 2 dump bodies on 2 Ford F-550 chassis for the Division of Transportation for a contract total not to exceed $66,498, contract pursuant to the Intergovernmental Cooperation Act.
A motion by Member Ozak, second by Member Garcia. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Ozak?
Thank you. I move for approval of DTR 008623, intergovernmental agreement between the County of DuPage and the City of Warrenville to resurface Warrenville Road between River Road and the bridge carrying Warrenville Road over the west branch of the DuPage River. Estimated county cost $22,500.
Motion by Member Ozak, second by Member Childress. Any discussion? All those in favor?
Aye.
Opposed? Motion carries. Member Ozak?
And finally, I move for approval of DTR 008723, intergovernmental agreement between the County of DuPage and the Illinois State Toll Highway Authority to establish their respective responsibilities toward the York Road reconstruction from Gateway Drive to Devon Avenue. Estimated county cost $24,793,250.
Motion by Member Ozak, second by Member Childress. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Thank you, Member Ozak. We move on to item number 9, finance resolutions, and I'll call Member Krajewski.
Thank you, Madam Chair. I move to combine items 9A, B, or 9A, B, and C, which are acceptance appropriation resolutions.
I have a motion by Member Krajewski and a second by Member Childress to combine items A, B, and C under finance. All in favor?
Aye.
Opposed, the motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0238-23, additional appropriation for the detention screening transportation fund, $254,000. FIR 0239-23, acceptance appropriation of additional funding for the low income home energy assistance program for going from $3,291,193 to $3,718,038, increase of $426,845. And then FIR 0240-23, acceptance and appropriation for our low income home energy assistance program in the amount of $5,528,383.
Motion by Member Krajewski, second by Member Garcia. Any discussion on these items? All those in favor? Opposed, the motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0236-23, annual financial commitments in support of DuPage Convention and Visitors Bureau for $50,000.
Motion by Member Krajewski, second by Member Childress. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Krajewski.
Yeah, that was fiscal year 23, so is that last year, this current? This is for the current year, that's about that. Move on, FIR 0237-23, service agreement between the county of DuPage and Choose DuPage for fiscal years 24 and 25.
I have a motion by member Krajewski. Who made that second? Member LaPlante. Have a motion, a second by member LaPlante. Any discussion on this item? Okay, all those in favor?
Aye.
Opposed? The motion carries. Member Krajewski.
I move on FIR 0256-23, approval of a grant agreement with Midwest Shelter for Homeless Veterans for $50,000. It's an ARPA item.
I have a motion by member Krajewski, a second by member Desart. Any discussion? All those in favor? Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. Last time move on FIR 0257-23, correction of a scrivener's error in the resolution FIR 0444-22.
Motion by member Krajewski, second by member Garcia. Any discussion? All those in favor? Opposed? The motion carries. Thank you, member Krajewski. Now we're going to move on to our 2024 budget resolutions and ordinances. And again, I'll call on member Krajewski.
All right, we're going to use the whole alphabet here, I think. So all right, let's move on FIO 0007-23, which are DuPage County 2023 tax levies for fiscal year 2024.
I have a motion by member Krajewski, a second by member Garcia. Any discussion?
Madam Chair,
Yes.
I did have a question. Could Nick talk about, we just got this, thank Rose for sending the proposed budget changes. Could Nick explain why we have so many budget changes to the budget before we pass the levy to pay for it?
Yeah, they're coming up here, members.
Thank you.
So the budget changes you have in front of you, a lot of these, if you look through, a lot of them have to do with the changes made in the insurance that the board made with the payout for people who did not take insurance. So that line item had to be taken out of every single budget throughout. And so that is part of it. There are other changes as well. Once the chair presented her budget, obviously talking to different departments, there were certain changes that were made. Specifically, we can go into any line items you'd like, members if you would, but if you look at them, there are a lot of the flexible benefit payments coming out and going into contingency. You'll see that in every single line in the budget.
Okay, the county infrastructure, 838,000.
Oh, that's the command vehicle that was approved by board.
Okay, and then the care center, 688,179.
That is which one is that? 688, where is that?
Special revenue.
Care center. No, that's indirect cost allocation. So that was it's budget neutral.
Okay, thank you.
Any other questions on?
Any other questions?
business?
Member Desart.
Thank you. Yeah, I had a bunch of questions about this. I just wasn't sure where to bring it up. I looked it over with the magnifying glass.
I have my reading glass.
So yes, I was looking for reasonings on some of this. Number one, the general fund transfer in sale in error interest. What is that? Transfer of sale and error? Was
So-
there an error in a sale?
Yeah, the treasurer's office has a separate fund called sale and error interest. And I believe there's money set aside in case during tax sale, there's any mistakes. So in the interim, that fund earns interest, and any interest that's earned gets transferred to the general fund.
Okay,
So you'll see it coming out of the sale and interest fund and transferred into the general fund.
and so for this year, it's 110,000.
We believe it is, yes.
Okay. Number two, public defender, the regular salaries. The original proposal was $50,000. That must have just been a placeholder because then the chair recommended $5,565,638. So the 50,000 for the original proposal
No, they're adding 50,000.
was a placeholder.
They're adding 50,000.
It's an increase of the original Chair recommended was 5.5 million. We increased it by 50,000. Now it's 5.61 million. For the,
But under the 50,000, it said that it was the original proposal.
if I'm looking right here, you're talking regular salaries, public defender. Chair recommended 5.5, proposed adjustment 50,000, new total 5.615, and then public defender funding from the state.
Okay, so the increase was $50,000 from the original. Number 3. County Infrastructure Fund. The automotive equipment for the sheriff. The original ask was $838,000. The chair recommended an additional $50,782. So the new number for the sheriff's automotive equipment is $1,338,802. So my question is, what does the chair know that we didn't know to add an extra $500,000 to this fund?
So that was the command vehicle that the board
Oh, the
approved
command
after the
vehicle, okay.
after the chair released her budget. And then this is just capturing that action by the board.
Thank you, Nick. And then I just had a question about all of the contingencies. And contingencies seems too broad for me. For example, DOT contingencies, the original ask was 3,000. The chair recommended $1 million. So the new figure is 1,003,000. And I could go to more DOT contingencies, stormwater contingencies, public works contingencies. What exactly does contingencies mean? Is that just a placeholder for, I mean, it just doesn't seem,
Yeah,
it seems too broad. There we go.
Well, I mean, that's in all the budgets, there is a contingency line item in the general fund and public works, DOT, all
And I think it's
enterprise
wonderful
funds.
to have contingency funds, but like, for example, the DOT ask was 3,000. And then the chair added $1 million onto that. So it seems like a huge leap for me.
DOT contingency, the original chair recommended was 1 million. And proposed adjustment is 3 plus 3,000 for $1.3 million. So the original chair was 1 million. There's a $3,000 difference.
So that means I've been reading this document wrong, because I'm looking at the top of the document and I see chair recommended, proposed adjustments, and then the new. But that's not. All right. And the same thing is true with the contingencies for stormwater.
Yeah, and
Public
if you
Works.
look, all of those are flexible benefits. I mean, they're minimal for each budget, but we have to figure out where to park that money now, because after the changes were made to the health plan, so that no longer exists. So we have to move that into contingencies.
All right, thank you both. And thank you, Member Zay, because I did have a bunch of questions about this item. And I didn't know where to ask these, so thank you for bringing them up.
Thank you, member. To start, I have member Schwarzy and then member Cahill. Member Schwarzy.
Oh, sorry.
Thank you. I'm going to just need some guidance on this question because I'm not sure where to ask it, but it involves the 1.5 million that the chair recommended for food using the ARPA money. $1.5 million isn't enough money, so I would like to talk a little bit more about that. This might not be the right spot. Tell me where the right spot to talk about this is.
So I think we might be discussing that during our budget meeting in November, when we have our surplus total amount. We can discuss taking money out of that, putting it towards food. Also, there's the RTA tax that we want to get some of that maybe over to transportation, and some other items. So I think that would be the appropriate time.
Thank you very
Yes.
much.
November
Thank you.
14th, we'll be having a fairly in-depth discussion on that.
Thank you, member Schwarzy. Member Cahill.
Thank you, Madam Chair. Quick question. The opt-out health insurance bonus, what's the total savings there? And does that go into our surplus? I see the line item for general fund, but I mean, what are the total of all the different amounts?
So the question was, how much by eliminating that?
Yes.
How much, if you remember, that savings was, there is a savings associated with that. That was brought into the rates that were given to all of the employees. So that savings is pretty much taken up by, because we reduced the rate increase for
Okay.
the employees of DuPage County.
Okay,
because
so
of
it's
that.
not going into the surplus. I understand. And do you know the total?
I have to get that for you. It was in the health insurance presentation.
Yeah, I thought it was a couple $100,000. I thought that we were able to lower, because if you remember, the original plan was to increase the rates by, I think, 5% for the employees. And I think we were able to get it in the 3.5% range because of that.
Okay, thank you.
Thank you, Member Cahill. I have Member Garcia and then Member Galassi. Oh, no, Member you and then Member Galassi.
Thank you, Madam Chair. So yes, I do want to talk about these flexible benefit earnings, these savings that you guys put directly into contingencies, just as in the DOT fund. There are 3 line items where the flexible benefit earning savings then goes into contingencies. And is that just standard practice to put it back into that same account as opposed to putting the extra money into general fund contingency?
So we cannot go from an enterprise fund to the general fund. So it must stay in the enterprise fund. And so whatever DOT earns, spends, whatever has to stay in DOT. Same with Public Works. There's several enterprise funds, but that's why, so you cannot cross over.
So then it can't go into surplus necessarily.
Well, it's surplus for DOT, but it cannot, DOT cannot come into general fund surplus.
Okay, thank you.
Thank you, Member you. Member Cahill? Did you have any, or Member Galassi?
Thank you, Madam Chair. So just back to the healthcare savings, when you brought the rate down from 5% to 3.5% approximately, did that get us back in the 80-20?
Yeah, we are absolutely, that was part of it is
Yep.
we task our healthcare consultant to get us in the 80-20 and obviously it depends what our claims are, but yes, we expect to be in the 80-20 range.
Perfect. Thank you.
Okay, thank you. Any other questions? Now, this is on the tax levy that we're voting on, not on the appropriation. So any other questions on the first item? Okay, all those in favor? Opposed, motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIO 0008-23, County of DuPage Hill Lighting Fund 2023 tax levy for 2024.
I have a motion by Member Krajewski, second by Member you. Any discussion? All those in favor? Opposed, the motion carries. Member Krajewski?
Hey, Madam Chair, I move on FIO 0009-23, annual appropriation ordinance for the County of DuPage, State of Illinois for the fiscal period beginning December 1, 23, ending November 30, 24.
I have a motion by Member Krajewski, second by Member Childress. And I see Member Evans has some questions.
No, it's a.
Oh, you can make an amendment?
Oh, yes. I would like to make a motion to amend this resolution to incorporate the changes outlined in the spreadsheet titled FY 2024 proposed changes. Per the spreadsheet that was emailed on Friday from the CFO and was handed out this morning, the amended appropriation for the general fund is $242,508,288. Special revenue funds, $371,720,249. Total fiscal year 2024 budget, $614,228,537.
I have a second. Motion by Member Evans, second by Member Trentori on the amendment. Member Desart, questions on the amendment?
Yeah, does this bind us prior to the November 14th major discussion about the budget?
No.
This is not binding at all?
No.
All right, thank you.
Okay, any other questions on the amendment? Okay, all those in favor? Opposed, motion carries. Member Krajewski?
I think we're now
Back to the original. We have a motion and a second. Any discussion on the original motion? Okay, seeing none, all in favor?
Aye.
Opposed, motion carries. Thank you, Member Krajewski.
Thank you, Madam Chair. I move on FIO 0010-23, annual appropriation ordinance for the police records management system.
Motion by Member Krajewski, second by Member Childress. Any discussion? All those in favor? Opposed, the motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0241-23, authorization to transfer funds to the taxable general obligation bonds.
Motion by Member Krajewski, second by Member Garcia. Any discussion? All those in favor? Opposed, the motion carries. Member Krajewski.
Madam Chair, I move on FIR 0242 23, abatement of the 2023 tax levy for general obligation refunding bonds, series 2015B.
Motion by member Krajewski, second by member Yu. Any discussion? All those in favor? Opposed, the motion carries. Member Krajewski.
I move to combine 10G, H, I, J, and 10K. They're all appropriation resolutions.
Motion by member Krajewski, second by member Tornatori to combine items
G
G
through
through
K.
K. All those in favor? Opposed? Okay, the items are combined. Please proceed, member
Thank you,
Krajewski.
Madam Chair. I move on FIR 0243 23, appropriation for limited tax general obligation refunding bonds, series 2016. FIR 0244 23, appropriation for the general obligation debt certificate, series 2017. FIR 0245 23, appropriation for the general obligation limited tax certificates, series 2009. FIR 0246 23, appropriation for the special service area number 35, which is series 2012A. And last is FIR 0247 23, appropriation for special service area number 37, which is the loan debt service fund.
Motion by member Krajewski, second by member Garcia. Any discussion on these items? All those in favor? Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move to combine 10 L, M, N, and O and P, which are all authorizations to transfer funds.
I have a motion by member Krajewski and a second by member Guston to combine items L through P. All those in favor?
Aye.
Opposed? Motions, the items are combined. Please proceed, member Krajewski.
Thank you, Madam Chair. I move on FIR 0248 23, authorization to transfer funds from the general fund to the tort liability fund, amount not to exceed $1 million. FIR 0249 23, authorization to transfer funds from the general fund to the building and zoning fund, not to exceed $333,000. FIR 0250 23, authorization to transfer funds from the general fund to the DuPage Care Center fund, or not to exceed $2,629,704. FIR 0251 23, authorization to transfer funds from the general fund to the stormwater management fund, not to exceed $2.6 million. And last, FIR 0252 23, authorization to transfer funds from the general fund to the county infrastructure fund, not to exceed $35,000.
Motion by member Krajewski, second by member Garcia. Any discussion? All those in favor? Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0253 23, approval of fiscal year 2024 headcount.
I have a motion by member Krajewski, second by member Childress. And we're going to have an amendment on this.
Here, Lucy, do this. 10Q.
Okay, I would like to make a motion to amend this resolution to incorporate the changes outlined in the spreadsheet titled FY 2024.
10Q. Down at the bottom.
Oh, all
10Q.
right. Okay, I would like to make a motion to amend this resolution to
The headcount.
this.
10Q.
Thank you. Oh. Oh, 10Q, approval of the 2024 headcount. I don't see anything else.
I think we-
From 0 to 5.
Can I
think
just
you said.
amend the motion? Why I'm not sure why I
Yes.
can't do that.
Can he just amend it?
Well, you
Go
just
ahead.
kind of told me I couldn't do that. I don't know why I can't make an amendment. So I'm gonna make a motion to amend the head count from 0 to 5 in the, which is the one, which is
Dujas.
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 That's what they gave me.
Okay, so I have a motion. Do I have a second on the
0
amendment?
to 5 and Dujas.
And
right?
Dujas, yes.
Yeah.
Second, okay. Any discussion on the amendment? Okay, seeing none. All in favor?
Aye.
Opposed? Motion's amended and we go back to the original motion. All in favor?
Aye.
Opposed? Motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0254 23, compensation structure wage adjustment guidelines.
Motion by member Krajewski, second by member Garcia. Any discussion? All those in favor? Opposed? The motion carries. Member
Thank you,
Krajewski.
Madam Chair. I move on FI 0011 23, 2023 tax levies for the Board of Health Operations for fiscal year 2024.
Motion by member Krajewski, second by member Childress. Any discussion? All those in favor? Opposed? The motion carries. Member Krajewski.
Thanks, Madam Chair. I move on FIO 0012 23, annual appropriation ordinance for the Board of Health Operations.
I have a motion by member Krajewski, second by member Rutledge. Any discussion? All those in favor? Opposed, the motion carries. Member Krajewski.
Madam Chair, I move on FIO 0013-23 annual appropriation ordinance for the Emergency Telephone Systems Board.
Motion by member Krajewski, second by member Schwartzy. Any discussion? All those in favor? Opposed, the motion carries. Member Krajewski.
Madam Chair, I move on FIR 0255-23 authorization to transfer funds from the general fund to the Veterans Assistance Commission not to exceed $683,306.
Motion by member Krajewski, second by member Childress. Any discussion? All those in favor? Opposed, the motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIO 0014-23 annual appropriation ordinance for the Veterans Assistance Commission fund for fiscal year 24.
Motion by member Krajewski, second by member Desart. Any discussion? All those in favor? Opposed, the motion carries. Member Krajewski.
Thank you, Madam Chair. This one doesn't have a number, but approval of our fiscal year 2024 financial plan.
Motion by member Krajewski, second by member Yu. Any discussion? Member Desart.
And again, I ask, is this binding based, continue to our November 14th discussion?
No, the only binding votes in county boards, so committee meeting are never binding.
Thank you.
Okay, thank you. Any other discussion? All those in favor? Opposed, the motion carries. Well, I think member Krajewski needs a round of applause for that, doing that. Thank you.
I was waiting for double A there.
Okay. We're going to move on to item information. I could call member Krajewski again.
All right, let's see if I can get through this. I'll make a motion to receive and place on file informational items, A, payment claims, B, wire transfers, and C, appointments.
I have a motion by member Krajewski, a second by member Guston to receive and place on file, items A, B, and C under informational. All those in favor? Opposed, the motion carries. We move on to old business. And then we are moving on to new business. Yeah, we did all of them. Yeah. Do we have any items under old business? Member Desart. Okay. A new business, member Desart.
Okay, thank you. I just wanted to say, and I'll say this at county board as well, congratulations to the DuPage Care Center. Newsweek named DuPage Care Center among the state's best nursing homes. So congratulations to Janelle Chadwick and her entire staff for the care that they bring to our community. Thank you. Oh, sorry.
Okay, I am advised that we do have executive session. Oh, I'm sorry, more new business. Okay, I'm sorry, member Krajewski, member Glassy.
Yeah, just we have a few special guests here visiting today. So Lucy, I know you got some on this side. I think we got them on both sides of the room. So maybe Lucy can tell us who we got here from District 3.
Yes, thank you, member Krajewski. I have students from not only Hinsdale Central High School, but also Nequa Valley High School. And Amber Quirk has somebody from also Hinsdale Central. Yep.
Great. Well, welcome to all the
Welcome
students.
visitors on both sides of the room here.
Yes, thank you. Thank you.
I think we have maybe AP government recommended, so maybe in a few years, you guys will be sitting right here in these same chairs, so. It'll be experienced, so, but welcome today.
Member Glassy.
Member Krajewski stole my thunder. That was what I was going to say. I also have students here from Hinsdale Central, which is my hometown high school. And I just wanted to welcome. Thanks for coming. You guys got to, you're going to get your money's worth today. So welcome.
Yeah, thank you so much, member Glassy. Okay, any other items under old or new business? Okay, seeing none. I am informed we do have matters before us requiring us to enter into executive session. I'll ask those not associated with executive session to please exit the room, and I will take a motion to go into executive session pursuant to the Open Meeting Act 5 ILCS 120/2 C21 semi-annual review. It has been moved and seconded. Moved by Michael Childress, second by member Desart. All those in favor? Opposed? Okay, we will head into executive session. Oh, can we have a roll call to go into executive? Roll call to go into executive session. All those, can we take a roll call?
Member Cahill, Member Chaplin,
Aye.
Member Childress, Member Covert, Member Desart, Member Eckhoff, Member Evans, Member Galassi, Member Garcia, Member Guston, Member Krajewski, Member LaPlante, Member Ozog, Member Rutledge, Member Schwarzy, Member Tortori, Member Yu,
Aye.
Member Zay.
Hi.
Okay, we're heading into executive session.